Hi.
Hi, go right ahead, sir.
Hi, I'm Anthony Maselli. I am employed as a health advocate at Miriam Immunology Center, working with newly diagnosed HIV patients and reaching out to those who are out of care. I'm just going to go ahead and read the statement I prepared for you because I'm very nervous.
Don't be nervous.
The most common reason advanced by policymakers for criminalizing HIV exposure or transmission is that people who transmit HIV or expose others to a risk of HIV infection ought to be punished because their behavior is morally wrong or harmful. However, most people who transmit HIV either do so not knowing they are infected and not knowing they are transmitting HIV, or because they fear that to reveal their HIV status will result in violence, discrimination, rejection by family and friends, and other abuses based on their HIV status. These fears, often well-founded, do not absolve individuals of the moral obligation to take steps to protect others from infection. However, to prosecute people who risk causing harm because of fear of discrimination neither deters their behavior nor achieves justice. Transmission with malicious intent is improbable and rare. Even in these cases, however, the creation of HIV-specific offenses is generally not warranted, as existing criminal laws are sufficient to punish individuals who specifically intend to transmit HIV to others. For example, laws against causing bodily harm can be applied to HIV transmission. Although it is appropriate to prosecute cases of actual transmission caused by malicious intent under existing criminal laws, care must be taken to ensure that these laws are not applied too broadly. In the overwhelming majority of cases, applying criminal laws to HIV transmission or exposure would do more harm than good. For example, criminal law cannot justifiably be applied to HIV transmission or exposure where there is no significant risk of HIV transmission, or where a person did not know that he or she was HIV positive, did not understand how HIV is transmitted, disclosed his or her HIV positive status to the person at risk, or had reason to believe the other person was aware of his or her status, did not disclose his or her HIV positive status because of fear of violence or other serious negative consequences, took risk-reducing measures, such as practicing safer sex through using a condom or other precautions, or previously agreed on a level of mutually acceptable risk with the other person. The broad language put forward in H5245 fails to address any of these situations. The application of criminal law to HIV transmission will also discourage people from getting tested and finding out their HIV status, as lack of knowledge of one's status could be the best defense in a criminal lawsuit. Indeed, in jurisdictions where HIV-specific criminal laws, HIV testing counselors are often obliged to caution people that getting an HIV test will expose them to criminal liability if they find out that they are HIV positive and continue having sex. These same counselors are sometimes forced to provide evidence of a person's HIV status in a criminal trial. This interferes with the delivery of health care and frustrates efforts to encourage people to come forward for testing. People may fear that information regarding their HIV status may be used against them in the criminal justice system. This impedes the provision of quality treatment and care, and could also negatively impact the enrollment of HIV-positive people into much-needed research studies. Applying criminal laws to HIV transmission or exposure frustrates these important public health goals. It fosters a climate of fear and retribution around HIV transmission, rather than a social and legal environment that is supportive of safe and voluntary disclosure of HIV status. An environment that, by endorsing the political declaration on HIV/AIDS in 2006, governments around the world committed to create a national response to HIV. I suggest that instead of applying criminal law to cases that affect public health, you should focus on empowering people living with HIV to seek HIV testing, disclose their status, and practice safer sex without fear of stigma and discrimination. Such empowerment would include protecting people living with HIV from discrimination by enacting and enforcing anti-discrimination laws and promoting social campaigns to reduce stigma. When there are low levels of stigma and discrimination in a social setting, people feel empowered to get tested for HIV and prevent the onward transmission of HIV. Additionally, where HIV-specific criminal provisions exist, only a few of the actual cases of HIV exposure or transmission are ever prosecuted. The wide discretion regarding which cases are prosecuted creates great scope for selective and arbitrary prosecution. Given the stigma that still surrounds HIV and the persistence of HIV-related discrimination, criminal sanctions are often directed disproportionately at those who are socially and/or economically marginalized. For example, in one jurisdiction, a homeless man living with HIV was sentenced to 35 years in prison because he spat at the police officer who was arresting him for disorderly conduct. Many other cases suggest that criminal law is invoked in sensational circumstances, often in retaliation to those who are most marginalized and stigmatized in a society, including immigrants and refugees, foreigners, or sex workers, and occasionally in response to emotional media campaigns. It is my personal opinion, and one I trust is shared by the public health community, that rather than applying criminal law to HIV exposure and transmission, governments must demonstrate political will and dedication of resources and implement evidence-informed programs in order to ensure HIV prevention services for all who need them. The allocation of limited resources to prosecutions rather than to HIV prevention measures that work and to programs to deal with the underlying causes is a misuse of resources. Applying criminal law to HIV exposure or transmission effectively shifts the total burden of HIV prevention onto people living with HIV rather than using proven methods to empower them to avoid the onward transmission of HIV and empower others to protect themselves from HIV infection.
Thank you very much for your testimony, sir.
Can I just read the last paragraph? I wrote something else as I was waiting.
Sure, go right ahead.
This bill adds insult to injury, aiming to spend the state's money on unnecessary and unlawful prosecutions instead of on evidence-based prevention. It is a slap in the face to every person living with HIV/AIDS in Rhode Island and elsewhere, as well as every advocate and health professional who has worked for years to dispel the type of stigma propagated by this measure, including several renowned Rhode Islanders, the former First Lady Stephanie Chafee, an AIDS nurse during the peak of the epidemic, and the Miriam Hospital's own Dr. Charles Carpenter, who co-authored the original national HIV standard of care that sought to remove the paranoid hysteria around this disease and ensure equal access to health care. Finally, I can assure you that if this bill comes to vote, not only will there be backlash from the HIV-positive community, but it will also be construed as a women's issue, a civil rights issue, a transgender issue, an immigrant issue, and a Black incarceration issue. And rightfully so, as we know that marginalized groups are far more likely to be disengaged from HIV treatment and viral suppression, and disengaged from counseling on safer sex practices and partner dynamics, due to the educational and health disparities that are largely ignored by this government. You would embarrass the state by moving against the advice of the CDC, the NIH, the President's Council on HIV/AIDS, the National Association of Nurses in AIDS Care, the National Minority AIDS Council, the Office of the President of the United States, the Office of the AIDS Czar, and even the United Nations, just to name a few. Spend money on prevention, not prosecution. HIV is a virus, it's not a crime. Thank you.
Thank you very much.